Can we make a comparison between my health journey using a GLP-1 medication and recovery from addiction? It can be, if we do this thoughtfully, as both processes really involve managing significant changes behaviorally, mindset, physiologically. Let's talk about how we can compare the two respectfully and the distinct differences and similarities. So if we think about similarities, the behavioral changes, the GLP-1 journey, really we experience this shift in our eating habits and a reduction in that food noise. That food noise is that constant thought about food. This process can feel like learning new ways to engage with food and listening to hunger cues and what that feels like. When we think about recovery, involves altering behaviors, avoiding triggers for substance use, which often require retraining our brain and our body in a way that it responds to cravings or emotional stress. And if we think about that mind-body connection, both journeys highlight the intricate relationship between our mental and physical health. GLP-1's impact on our hormones and our brain pathways related to satiety and cravings, while addiction recovery often requires addressing both the physical and the psychological dependence on these emotional patterns, very similar to substance use. The success in both journeys often depends on the external support, such as healthcare providers, therapists, our community, and having a community and those professionals to help guide us can really help navigate the challenges and maybe setbacks. And then there's the stigma. There's a societal judgment around needing medications for management of our chronic conditions and battling addiction. So we can really work on battling that stigma and improve our health and our well-being. Using a GLP-1 journey for me has been about maintaining a lifestyle change, balancing all the things, trying to for the long term. Recovery is a continuous process of maintaining sobriety and managing those triggers, often described as one day at a time. I sing that often, one day at a time, sweet Jesus. Anyways, physiological changes. We have to think about the biological mechanism. There's that blood sugar regulation and satiety hormones, often used for treating metabolic disorders like diabetes and obesity. We have to rewire our brain, that reward system, after a period of dependence on substances like food, alcohol. Recovery is widely recognized by supported programs, 12-step, whereas GLP-1s are kind of newer in the face of misunderstanding and resistance in public discourse. If we think about our goals, the goal of the GLP-1 therapy is typically improve our metabolic health, better management of chronic conditions, whereas the goal with addiction is to achieve and maintain sobriety alongside addressing the psychological and social consequences of addiction. So let's reframe this, shall we? Let's use empathy and avoid oversimplification or assumptions about either journey. Both involve unique struggles and triumphs. Acknowledge that while there are similarities in behavioral and emotional challenges, the psychological, physiological mechanisms and societal perceptions differ significantly. What is your personal experience on this journey?